Omega-3 index is directly associated with a healthy red blood cell distribution width. A study investigating a relationship between omega-3 index and red blood cell distribution width in healthy adults has found a direct association between a high omega-3 index and an optimal red blood cell distribution width. Here's what you need to know. The red blood cell distribution width, or RDW, is a convenient and cost-effective measurement performed in a standard, complete blood count and assesses the range in the size and volume of red blood cells in a blood sample. It is usually taken along with other blood tests to test for blood disorders like anemia and other conditions such as cancer, diabetes, heart disease, and autoimmune disease. A typical range for RDW is about 11 to 16%. When it's higher, it may predict decreased deformability in the red blood cells, which is the ability of the red blood cell to change its shape and move through the capillaries easily. A higher value may also indicate the presence of certain diseases or a nutrient deficiency. Several studies suggest that an elevated RDW is associated with an increased risk of hypertension, heart failure, death, stroke, metabolic disease, and disease severity and death in patients with COVID-19. On the other hand, the omega-3 index measures omega-3 fatty acids content, eicosapentaenoic acids, EPA, and docosahexaenoic acids, DHA, in the red blood cells and is a strong predictor of a person's risk of heart disease, death, premature birth, and death from heart disease. Omega-3's EPA and DHA are essential nutrients that the body gets from foods like salmon, sardines, mackerel, and supplements. These nutrients support heart health, brain health, healthy aging, immune health, eye health, and joint health. What's more, experts suggest that high omega-3 levels increases a person's life expectancy by close to 5 years. An optimal omega-3 index falls within 8 to 12%, and when it is below 4%, it's a risk factor for death from heart disease. However, globally, our diets lack omega-3s. This deficiency is associated with 1.5 million deaths and 33 million disability-adjusted life years lost to premature deaths. According to the study researchers, since both omega-3 index and RDW are risk factors for death from all causes and both are associated with membrane fluidity, the ability for molecules in the cell membrane to move readily, and RBC deformity, they sought to explore if there's a relationship between omega-3 index and RDW. The study was a cross-sectional analysis of data, meaning it analysed data collected at a specific time from blood samples submitted for testing at a certified clinical laboratory between 2011 and 2012. It collected RBC data from 45,715 adults, but was left with data from 25,485 people after excluding those with tissue injury, anemia, or inflammation. The study found that there was an inverse relationship between omega-3 index and RDW value. A higher unhealthy RDW was linked with lower suboptimal omega-3 index values. The researchers put forward the possible mechanisms at work that may explain the relationship. 1. Omega-3s influence membrane, fluidity and deformity, and an elevated RDW is associated with decreased RBC deformity and membrane fluidity. Therefore, lower omega-3 index may result in a rise in RDW. 2. Oxidative stress, a state that reflects an imbalance between the body's antioxidant levels and its free radicals, has been shown to impair red blood cell production, and this impairment may lead to an elevated RDW. Studies suggest that omega-3s may prevent or reduce oxidative stress, thus supporting an optimal RDW. 3. Lastly, there may be a direct relationship between omega-3s, RDW, and inflammation. Inflammation may increase RDW, which may explain why a high RDW is a risk factor for heart disease and death. In contrast, omega-3s are anti-inflammatory. Therefore, omega-3s may prevent or reduce inflammation, which in turn reduces RDW. The researchers concluded that an omega-3 index above 5.6% may support healthy RDW.